Here's case number 1, a 55-year-old night shift emergency room nurse with excessive sleepiness. Female Caucasian, she's 5'8", weighs 185 pounds, and she complains of chronic tiredness. Her work schedule is as follows: 7 p.m. to 7 a.m. Wednesdays through Fridays. Shift days can change during the month. Her sleep times are as follows: 10 a.m. to 4 p.m. during the days after a shift, followed by a brief nap prior to work. Other days, 12 a.m. to 7 a.m. And she takes care of her father on those other days. Now, she's prescribed Zolpidem by her coworker physician, and her blood pressure is controlled at 135/75 with a thiazide diuretic. There's no history of snoring, but often she talks in her sleep. Blood glucose levels are normal. And here's your question. So, which of the following recommendations is best? The patient should not have a sleep problem because she only works the night shift 3 days a week. Number 2, the patient should be referred to a sleep specialist. Number 3, the patient should be encouraged to drink coffee during the first few hours of her shift. And number 4, the patient should continue taking Zolpidem for insomnia. Make your selection now. So, Carl, the correct answer is number 3. The patient should be encouraged to drink coffee during the first few hours of her shift, right?
Exactly. And we say many negative things about caffeine, but as we've learned before, caffeine, which is timed at the right time and at the right dosage, can be very helpful in terms of increasing alertness, which is the main problem with this individual. She complains of fatigue during the work hours. It can increase alertness, increase performance, and can be very helpful in the case of many shift workers. But again, not too close to bedtime and at the right dosage.
Right, and also those nights that she's not working, we want her not to have caffeine so that she doesn't develop tolerance. Is that correct?
Exactly, not too close to bedtime at least.
Not too close to bedtime. Why isn't the first question right? I mean, she only does shift work 3 days a week, so she really shouldn't have a sleep problem.
Well, in a sense, it begs the question because she really does have a sleep problem. And the point made, of course, is that individuals who only work a few nights a week can develop shift work disorder because of the chronicity of the problem, chronicity of the pattern, and number 2, because of their own individual vulnerability to shift work. So the chronic disruption of sleep-wake schedule, even if it only involves 3 nights a week, can contribute to shift work sleep disorder, that is. And of course, the second point on this slide isn't necessarily true because people with shift work disorders don't need to be referred to sleep specialists unless, as we've mentioned before, the physician does not have a comfort level with treating these particular patients or may suspect other comorbid disorders.
Absolutely. And Carl, you know, this is a primary care a condition that primary care providers should be pretty comfortable taking care of. I mean, it involves getting a good sleep history, educating a patient, and telling them what they need to do. And there's so many things that they can do that have nothing to do with medication. And again, sleep hygiene and using melatonin wisely, using light therapy wisely, this is perfectly geared for primary care. After all, we consider ourselves pretty good educators and speaking to patients. So primary care providers should really do a good job identifying and treating shift work disorder. So I would say to you that even though you're a sleep specialist, and I want to refer patients to you, that the majority of our patients coming in with this, we should be able to treat them adequately. Number 4, the patient should continue taking Zolpidem for insomnia. I guess that's appropriate, but it's not going to solve her daytime sleepiness, is it?
Precisely.
Or her shift work sleepiness.
Exactly, and she continues to be symptomatic despite use of Zolpidem. So as the choices correctly point out, hypnotics alone are often not sufficient to treat all of the underlying symptomatology of shift work disordered patients.
So it's not wrong for the patient to take Zolpidem, it's just that it's not going to improve daytime sleepiness. So you do think that she can certainly continue taking Zolpidem appropriately, right? Isn't that correct?
Exactly, and we just don't know exactly why she's on it and what situation prompted her to be on it, but presumably she should stay on it if it's helping her.
All right, next question. Treating a night shift worker's insomnia by ensuring 8 hours of sleep during the day will usually normalize his or her performance during the night shift. Hopefully a pretty easy question, but is this true or is this false? Make your selection now. All right, Carl, we've talked about this, and hopefully we've made this point on several different occasions. But making somebody sleep better is not necessarily going to translate to improved daytime alertness, is it?
Exactly, and the studies have confirmed your point that hypnotics do not seem to translate necessarily into optimal daytime alertness. Not that we should not use them for insomnia. Of course, they're very well suited for insomnia. but to be able to manage all of the different dimensions of shift work, another approach or additional approaches may be necessary.
Right. So the correct answer is false. And let's also keep in mind that even though we can lengthen their sleep with their insomnia and it won't make their alertness better, if they take naps, which is more sleep, that will improve their daytime alertness, won't it?
Naps during the work time, as well as before coming into work, may very much diminish their daytime sleepiness, and studies have shown this, that these types of naps also improve functioning or performance during the course of their work.
Excellent. All right, question number 3. Which of the following is an approved therapy for excessive sleepiness associated with shift work disorder? Number 1, Ramelteon. Number 2, modafinil or armodafinil. Number 3, Zaloplan. And number 4, there are no approved drugs for shift work disorder. Make your selection now. Well, Carl, we discussed this earlier, and really there's only 2 medications, prescription medicines, indicated to treat the excessive sleepiness of shift work disorder, and that's modafinil and armodafinil. So it is something we can use for our patients, isn't it?
Precisely, and the other choices on this slide that are mentioned, Ramelteon and Zaloplan, although could be very, very useful for insomnia. And their nighttime patterns of sleep, or daytime sleep patterns, of course, may not necessarily translate into alertness. There's some interesting work that's being currently done with Ramelteon for shift workers, but of course that's in the investigational stages at this time.
But again, as the story unfolds with a patient that has shift work disorder, hopefully we've made this point to educate and then to have them make appropriate changes in sleep hygiene, appropriate changes utilizing light and dark therapy, and using melatonin. And then the option for medication certainly is their prescription medication, and in this case, modafinil and armodafinil. Question number 4. What is the correct ICD-9 code for shift work disorder? Is it number 1, 327.31, number 2, 327.36, number 3, 327.37, number 4, 292.85, or number 5, any of the above are okay? Make your selection now. Carl, this is a tedious question, and sometimes it's difficult for us to remember numbers, but we're trying to make a point here that there is a definite ICD-9 code for shift work disorder, isn't there?
Exactly, and we're trying to be, of course, as you know, as specific as possible when we make diagnostic formulations for patients. And the one that's most specific for shift work sleep disorder, shift work disorder, is number 2, 327.36. I don't recall what the descriptors are for the other codes on the slide. However, there may be insomnia or other disorders noted, but the one that's most specific for the disorder we've been discussing today is number 2.
Okay, just for the audience, the 327.3s are the circadian rhythm misalignment disorders. That includes delayed sleep phase, advanced sleep phase, jet lag, etc. And 327.36 is the one for shift work disorder.